Postpartum depression is just another form of depression. It just happens to occur following the birth of a child. The symptoms can be the more typical, sadness, loneliness, not sleeping well, which happens when you have a kid anyway, not having much appetite, being more withdrawn. Postpartum depression is also common in dads. We think it's about 5 to 10% of fathers, as opposed to 10 to 25% of mothers, but those numbers are likely underestimated because in order to know the prevalence of an illness, we need to be able to ask the fathers how they're feeling, and a lot of times the father is back to work, they're not present at the postpartum visit with their wife for their OB. So until we can ask them and find out how they're feeling, we don't really know the true prevalence of it. The biggest problem with postpartum depression for dads, most people don't even know it exists, so why would you even be asking about it? Why is Joe acting that way? He's just having a rough time at work. Actually, he could be depressed. A mother typically wants to love their child and doesn't understand why they're not able to do that. The father can be very angry and hateful towards the child. The most important way to cope with postpartum depression is to talk to somebody about it. Cognitive behavioral therapy is the number one way to learn how to see your emotions for what they are, and that there isn't, in fact, anything wrong with the child or with yourself. Some people need to resort to antidepressant medications, just as they would with any other form of depression. If I speak from my own experience, and I did suffer from postpartum depression when my son was born, I think I was a typical father. Everything seemed normal. I was very excited that we were having a boy. By the first 24 hours, though, I was already, because he was very cranky baby, I was already nervous that there was something wrong with him. I was back at work, and I would come home, and my wife would hand me my son, and I would just hand him right back because he would just scream. I'm like, I don't want him. I began to realize that there might be something going on with me at that point, and I did actually look up therapy, but I didn't make the phone call because maybe I also thought it'll get better. I don't need this. By about week 4 or 5, we hit rock bottom. I was getting some very negative thoughts in my head about my family, about my child, and I just broke down one day. I made the call. By the next week, I was going to the therapist. It took roughly 2 months of therapy before I really started to feel better. As with any mental illness, there is a stigma. But in terms of fathers, I believe that stigma is even greater. With women, it's been a slow breakdown that more and more women have talked about their experiences, so it's not as taboo to hear about. If you think about the characteristics that are typical of men, sadness, weakness, these are not typically manly things that you hear about, especially culturally in the United States. So for a man to admit openly to generally a stranger, a pediatrician or an OBGYN, that they are suffering is a big thing. By and large, talk to your physician. We have many resources available to us that we can help to guide you towards. I think you can read all the books in the world, but until you actually have that child in your arms and you have to take care of it, the book is not going to help you. I think that you should be having a child because you want one. You should be excited about it, but you should be honest about the challenges that are going to come.